The Workplace Wellness Program is designed to help organizations determine when it's safe for employees to be present on premises and when they need to self-isolate or quarantine at home. So based on a combination of data provided via a daily screening questionnaire, such as the one we see here, together with medical and medication status for that person, and additionally events such as COVID-19 test results or vaccinations. The purpose of workplace wellness is to answer not only the question of whether it's safe for people to be physically present at work or school, but also if they do need to isolate, how long they need to do so before it's safe to return to their workplace. So we'll start by simulating the login of a specific user in a demo account that we have here. So when logging in for the first time to the application, the user sees a two-screen questionnaire related to medical conditions and medication. The answers to these questions affect some of the results that might come out later based on the screening questions and events for this employee. So we fill in these two screens of questions, and then we get to the daily screening questionnaire. This is the questionnaire that people see day to day and that they need to fill in. And they have the standard COVID-19 related questions such as, have you been in contact with someone diagnosed with COVID-19 in the past 10 days? Have you traveled out of the safe zone? A list of several symptoms that have been identified to be linked with COVID-19. So if we complete a totally clear set of answers here and we determine our current temperature is normal, the method by which we took that temperature is important because it affects the accuracy of the value that we record here, and we submit. Then we see a clear to return onto premises result, and that employee is now safe to go to work that day. Now, simulating the exact same scenario potentially for next day, so we have the exact same person logging in. You'll see that now after login, we do not see those two initial screens with medication and medical condition questions. They have been already stored in the back end. And now we just get the daily symptoms and other related questions. So if we do answer yes to some of these, so we have a fever in the past 24 hours, we had shortness of breath, no chest pain, and let's say we also had nausea, and our current temperature is slightly elevated. So now when we submit a result, the response that comes back is that based on the answers that we gave, we are not clear to return to on premise today. And if you have not had a test in the past 3 days, the recommendation is that we do so. Whenever such a result is produced from the app and the rules that work based on the answers given, then an email is sent to the organization and the specific sub-entity to which this employee belongs to notify that such a not cleared result has occurred for this specific employee. So this is the day-to-day process that people go through filling in that screening questionnaire. Now, in the back office, authorized admin staff have access to an admin portal where they can review the submissions and the results from the employee activity. So a quick dashboard screen here on the landing page shows a graph and a trend of total submissions per date and back a certain number of weeks or any time period, and of those submissions, how many of them were not cleared. This is also filterable by, apart from date, also by entity. So an organization might have multiple branches or locations or entities, and we can filter this data down further. A graph of cleared versus not cleared results on today, on the specific day, so 2 not cleared and none cleared. And out of the total employees in the organization, 3 in this test scenario, how many have submitted a form today? So 2, and how many have not submitted a screening questionnaire? So there's just 1 there. So this is a quick dashboard view, but all of the data is individually reviewable here in the submissions list. So this is a normal searchable, sortable list, so we can drill down if we'd like with any more details. This is the submission, the not clear submission that we just did with our demo user who is called Colin Danvers, and you can see the answers provided here and the results that came back as not clear. As you can see, the sensitive data, the medical info that was submitted originally, is not visible here at any level. That's just for the rule engine to calculate results and conditions based on that data. As we saw, the screening questions produce a certain set of results, but we can also define events for employees. And one event, for example, might be a COVID test, and the result, for example, might be positive. There's a default validity of that COVID test that comes from CDC WHO guidelines, currently at 10 days. And let's mark this marked as today for this user, Colin Danvers, and this has been validated by the backend. So as soon as we've logged this a positive COVID test for this individual, then the rules to determine what kind of results we see here are updated. So if we now try to log in again with this user, like we did before, and if now we submit a totally clean sheet, no symptoms, no contact whatsoever, when we do submit our form, we're told that there's a positive test in activity, and that means we're not allowed to come back to work. And the duration for how long this lasts, again, is nominally 10 days. If we switch to a calendar view, we can quickly see that this individual for this specific entity has a positive COVID-19 test, which means that they are unsafe to return to work for at least this period, that 10-day period. This period might be extended depending on other data and activity that might happen here towards the end of that period. But the minimum duration that an HR department, for example, might need to calculate and take into account for how long a person will be out is displayed quickly here in the calendar view. And an event can not only does not to be only a COVID test, it can also be a vaccination. And again, depending on the data provided and the rules, these affect what kind of results people will see on their screening form result screen. The users themselves are managed via user management screen, where we provide data such as their basic name and grade and role, but also which branch they belong to. Again, this helps with contact tracing efforts later on if there is some result that needs further investigation. And all of the alert emails are configured per branch. So if an employee belongs to a specific branch or entity under the organization, then we can have one or more email addresses to where the email notifications automatically go when a not clear to return result has been calculated. Finally, all of the events and the rules here are monitored and curated by team medical professionals to follow the currently established global WHO and CDC guidelines. And because we are learning about the disease all the time, these are built to be easily updatable in the backend, so that the absolutely latest information about the validity of each of those events can be implemented into the application.